I am originally from Volga, graduated from Sioux Valley, was raised on a farm south of Volga, born at the Volga Hospital. Well, I started having some symptoms, and they said your symptoms could be sleep apnea. So they sent me to pulmonology, and then pulmonology says, well, let's do a sleep study. I said, can I do it in Brookings? Sure. Sent the order. There is a machine, and it's all electronic, computerized. I don't know. It's I don't know how they do it, over the internet, but it's just fantastic. I was afraid if I had to sleep here, I wouldn't get good sleep. My husband requires insulin, but he still cannot give it to himself. I make sure that I wasn't away for an extended length of time. That I have moderate sleep apnea. I snore probably. I don't know, but that's what my husband says. And then you have episodes of stopping breathing. And so mine was, I think, more than 10 times per hour that I stopped breathing. So then you're not getting the rest you need. And I had some other symptoms, like a headache by noon, leg cramps, just terrible. It's a machine that forces air. And there is a little container for water, so you're getting moist air with a hose. And again, I went to the Equip here in town to get mine, and that's 45 minutes of education, which is fantastic. And then we tried on different face mask things, and I settled for it's a nose and mouth one. And then when you start to go to sleep, the air, I don't know if it's called pressure or whatever, the airflow is less. And then apparently throughout the night, it gets stronger. And so I started out and I'm like, oh my gosh, I can't handle it this strong. So they went to Equip. They turned it down there. I don't take as many afternoon naps. And my activities of daily living, like doing the dishes, laundry, and that kind of stuff is, I don't want to say easier. It's just, I don't mind so much doing the normal chores that you do. One of the best things. That's why I don't feel the need to take an afternoon nap. Because I would get a headache, and then it was like, okay, it's one of those headaches where you have to close your eyes. I would say that's probably 75 to 80% better. Well, the girl that gave the education, you educate and you chit-chat, and to me, a smaller community is, somebody who knows somebody who's related to somebody. And so you connect on a personal level, which I think is very important. I would say don't be in denial. And it's not a horrible diagnosis. It's not a horrible treatment. It's not painful. So just don't put off, and just keep up on your health care.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.